Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal Rx.
If you have carpal tunnel syndrome, then you might be experiencing one of the major symptoms of this condition, and that's numbness and tingling in your fingers and hand. But it's very common to have other symptoms in your wrist, hand, and fingers, like pain, soreness, and burning. It's also quite common that the numbness and tingling will wake you up at night, and it's usually felt in your hand and fingers, but not your little finger. Given the increasing amount of work that we do with our hands every day, more and more people are complaining of carpal tunnel numbness, tingling, pain, soreness, and burning. And since it's practically impossible for us to not use our hands every day, the prevalence of carpal tunnel syndrome is increasing rapidly. So what exactly causes this condition? Carpal tunnel syndrome is actually a disease that begins deep inside the wrist joint, inside a confined area known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, like rapid hand movement, that sheath begins to swell and it pushes against the median nerve. And that's what causes the numbness, tingling, pain, and other symptoms of carpal tunnel syndrome. If your carpal tunnel syndrome is causing you to have numbness and tingling in your fingers and hand, as well as other symptoms like pain or burning, you'd like to know what you can do about it. If you're thinking of having carpal tunnel surgery to relieve your symptoms, discuss with your doctor the fact that most people are dissatisfied with their surgical results, while the overwhelming majority of people who use non-surgical therapy are very satisfied with their results. Your doctor should candidly and openly inform you of this, because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Those non-surgical therapy options are rest, night splinting, and deep tissue massage. These simple methods are very effective in relieving symptoms. In fact, deep tissue massage is nearly 100% effective, but only when applied daily and for 2 to 4 weeks. Otherwise, it won't alleviate symptoms. Thanks to a new technology, you don't have to see a therapist every day to get this treatment. This technology is the amazing Carpal Rx. It's like a take-home therapist, where you put it on your forearm twice a day for 15 minutes. It's carefully calibrated to produce the same motions, speed, and pressures that a therapist uses when performing deep tissue massage on your wrist and forearm. And it's so simple to use. Just plug it in, slide it on, strap it in, and relax. The Carpal Rx will do all the complex deep tissue massage for you. So stop waking up in the middle of the night to shake out your hand, and throw away all those splints and braces that just don't work. And don't even think about having surgery. If you have carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury, you owe it to yourself to try this remarkable product. The Carpal Rx always comes with a 60-day free trial, so if you're not completely satisfied, return it for a complete refund of all of your money, including your shipping costs. The Carpal Rx is guaranteed to get rid of all of your symptoms, and it will do it easily, completely, comfortably, and cost-effectively. Remember, it's completely guaranteed to work for you. Learn more at carpalrx.com.